This is week 2 of dry needling for this particular patient. In the assessment of scar tissue working on those adhesions, really working to lengthen, stretch, and mobilize that scar tissue, it's really good to assess what is going on deeper in regard to the fascia. In this particular case, the patient has had 4 different surgeries within her abdomen. So she's had an appendectomy, which are 3 scars kind of up the midline, 2 C-sections, and 1 hernia surgery. So there is an abundant amount of scar tissue within the abdomen, thus creating tension, not just in the abdomen, but also up through the diaphragm in regard to all the fascia that is attached to that lower abdomen. Just like in week 1 of this particular procedure, the doctor is going to assess for the tension in the area. And again, working to break up the adhesions, because scar tissue, once broken up, stays broken up. It's not like a muscle that can get tighter with tension. So when you do work like this with dry needling, you break up the adhesions, they stay broken up. So that is the true beauty of working on scar tissue like this, even if it's older. And again, in this particular case with this particular patient, the scar tissue is over a decade old. So it's never too late to work on the scar tissue, but would it be more beneficial to work on it earlier? Absolutely yes. When the dry needling is complete, the doctor then works to really mobilize the scar tissue. So you can see here that she's compressing on either side of the scar, and with micro movements under her fingers, she's compressing and moving back and forth where she feels the most tension. Just as we discussed in the previous video, this type of maneuver can evoke a lot of emotional response. It can be very intense in regard to the therapy and just how much work needs to be done within that fascial layer. But again, very beneficial. Now, in this particular case, the patient also has a history of a hip labral tear on the right side. And so they were talking about the fact that this scar tissue through the C-section, through both C-sections, contributed to the scar tissue through that right side. Typically, a patient with a C-section scar is going to have one side that is excessively tight versus the other based on the surgeon that was working on their C-section scar. This isn't a rule, but typically when a baby is being removed from a woman's abdomen with a C-section, the surgeon has to operate from one side or the other based on their dominant hand. Well, not even that. Based on getting the baby out and needing to pick a side. So that dictates the pressure and the maneuver through one side versus the other. In this particular case, the patient surgeon was working on the right side of her body, which might have led to excessive pull, not excessive, but to an increased pull through the right side versus the left. When she experienced the hip labral tear, it was through the right side of her hip area, not her left.
Yeah, right. And she is the type
in week 2 of this series, in working on this patient's scar tissue, the doctor also started working into the umbilicus area, into that belly button area, in addition to the actual scar itself. Mobilizing, creating movement, again with that leg that you saw in the previous video, creating a lot of activation, also with stretch, but also adding in that umbilicus work, because again, fascia is attached throughout your body. It's like one big saran wrap across your entire body. So you can imagine if you're pulling through the abdomen, you're getting excessive pull through that scar tissue, it is going to affect the fascia that is then attached to your belly button, to your abdomen, to your diaphragm, which will essentially affect the way you breathe, the way you stretch, the way you activate those deep intrinsic muscles. So working on all of these areas and gradually adding different areas for work can be really beneficial for your activities of daily living, for the things that you're wanting to accomplish every day.